we have some more doctors who are coming in, but we are starting with the presentation because since you are waiting, all of you, we would like to thank all of you for your time. All of you are out of your busy schedule, you have given us some time. I would like to introduce Dr. Nakagawa-san. He is from Kaneka Corporation. He is the inventor of Flabonoid, licorice Flabonoid oil. Hosoda-san is there. He's from marketing. Please come, Hosoda-san. He's from Kaneka Marketing. And Dr. Thakur, he's done a lot of research on infertility and clinical research on effects of ubiquinol for infertility, male infertility. So please come. We'll start with the flavonoid presentation first. So Dr. Nakagawa, over to you.
So thank you for giving me an opportunity to talk about flavonoid. I will start. So flavonoid, our brand name is flavonoid. It's oily extract from root of licorice for fighting metabolic syndrome. So the raw material of this flavonoid is Glycyrrhiza glabra. It's a licorice, a species of licorice. And this have both long history and safe use. And how we discover this is we screen hundreds of food ingredients, and we found oily polyphenol, mainly premil flavonoids, derived from this root of licorice, can improve abdominal obesity and diabetes. So we decided to study and develop this ingredient. So as for manufacturing process of flavonoid is, so glabra, root of glabra was extracted with ethanol and subsequently dissolved with MCT. It's a food oil, middle chain triglycerides. So flavonoid contains 30% of glabra polyphenols, and the major substance is glabritine. This is one of polyphenol. So flavonoid is standardized to 3% glabritine, which is a major polyphenol of flavonoid. So next, I would like to talk about the concept of flavonoid. Before explaining this, I will show the animal study on the effect of flavonoid on fat and muscle mass. So abdominal fat and femoral muscle weight of mice were measured after 1 month administration of flavonoid. So as you can see here, the weight of abdominal fat of the mice flavonoid group was significantly decreased. On the other hand, that of femoral muscle weight is significantly increased. We found this by chance. So our concept of flavonoid is flavonoid changes your fatty physical makeup to a fit and healthy body by decreasing body fat and increasing muscle mass. So now we are proving this in human, and we're getting good result. So I will explain this. So next chance. So today I will talk about obesity and metabolic syndrome. So flavonoid, develop muscle mass, which result in the increasing basal metabolism and burning fat. So we will have a good circulation. So it is expected that the combination of flavonoid and daily physical activity, such as shopping, cleaning, and commuting, accelerate the improvement of body makeup. And so flavonoid is an evidence-based supplement ingredient. So we verified the evidence on the reduction of body and visceral fat with mice and human. And also, we elucidated the mechanism of reduction of body fat with the DNA microarray study. I will show it later on. And also, we accumulate safety data. So we have approval of NDI notification by FDA in the US, and also novel food ingredient in the Europe. So we have several human studies for in order to demonstrate it prevent metabolic syndrome and obesity. And as a result, reduction of body fat mass, including visceral fat, body weight, and blood cholesterol level, and blood glucose level by ingestion of flavonoid was clinically verified in human. So I will show some data. This is the data in the US, the body fat reducing effect in American obese and overweight subjects. It is already published. So almost 100 adults, men and women, with BMI of 30 to 40, so quite big people. And this is a 12-week double-blind randomized controlled trial. And the subjects took 3 soft gels, capsule containing 300 milligrams of flavonoid. So as a result, CT scan analysis revealed that abdominal fat, like that. So these two studies is quite consistent. So this is a different study. So this is a 2-month efficacy study with up to 300 milligrams of flavonoid in the Japanese subjects. They are overweight subject. And it is 8 weeks double-blind randomized controlled trial. And they took 100 milligrams to 300 milligrams of flavonoid a day. So as you can see here, and also fat mass was evaluated by DEXA, dual X-ray absorptiometry, which is a quite accurate method to assess the body composition, such as bone mineral and fat mass. So as you can see here, intake of flavonoid, after intake of flavonoid, subject lost almost 1 kilo of body weight. So it's important, not body weight, it's fat mass. So it's quite a simple calculation. This study, 2 months, 56 days, intake of flavonoid for 56 days resulted in 1 kilo reduction of body fat. So 1 kilo of body fat almost equals 7,200 kilocalories. So this is quite simple calculation. So daily calorie consumption by intake of flavonoid is about 130. So it's achieved by walking at 6 kilo per hour for 30 minutes. And also this 130 kilocalorie is equivalent to calorie consumption of 50 grams of naan and 1 slice of bread and milk, 200 milligrams, and 3 slices of meat and a glass of beer. So I think it's expected that the intake of flavonoid with exercise or mild food calorie restriction is very effective. And also in this study, we demonstrated that the visceral fat area by CT scan was decreased at 8 weeks in 300 milligram group. And also BMI was significantly decreased 300 milligram flavonoid group from 4 weeks. And also cholesterol level was significantly decreased at 300 milligram per day dose group, like this. And also more significant efficacy was observed with subjects with higher cholesterol level over 120, like this. So next, we elucidated that the mechanism of action for decreasing body fat and visceral fat by Flabonoid. So high-fat diet-induced obese mice was fed with on the high-fat diet containing Flabonoid. As a result, abdominal fat accumulation was significantly suppressed in the high-fat diet-induced obese mice. So as you can see here, so in control group, only high-fat diet. So size of visceral fat was twice as large as normal. On the other hand, in the Flabonoid group, the size of visceral fat is the normal. So it means Flabonoids suppress fat accumulation in the visceral fat cells. And in the liver, there are lots of fat droplet here in the control group. But in the Flabonoid group, the fat droplet disappeared completely. So it means Flabonoids suppress the lipid droplet accumulation in the hepatic cells. So in order to determine the difference in the hepatic gene expression between control and Flabonoid, we purified total RNA and submitted to a DNA microarray study. So this is the result. So it's a bit complicated. So fatty acid, so from diet, become acetyl-CoA in the liver cell and combine to L-carnitine and get into mitochondria. So beta oxidation is a cycle series of reaction with acetyl-CoA as the end product. So each cycle produces energy for ATP production. So EHHDH is a major enzyme in beta oxidation. So the expression of this gene became 2 times. And also ACAD is the same beta oxidation enzyme become 1.4 times. So it means Flabonoids activate beta oxidation. On the other hand, this is a fat synthesis pathway. So the expression of all the enzymatic expression was suppressed to 1/2 by the Flabonoid. So it means Flabonoid suppressed fatty acid synthesis at the same time. So Flabonoid is a unique ingredient that 2 functions, activation of beta oxidation as well as suppression of fatty acid synthesis. So next we made a hypothesis that if Flabonoid stimulates lipolysis, fat burning process, the skin surface temperature may be elevated. So in order to prove it, we did this study. So this is the open label crossover study. So 9 young women who have a cold constitution participated this study. And they took a single dose, oral dose of 600 milligram Flabonoid. So skin surface temperature of forehead, such as abdominal area and back was measured with temperature sensor for 94 minutes in the temperature control room at 22 degrees. As a result, so average skin temperature in body trunks such as forehead, neck, abdominal, and back was elevated by single dose of Flabonoid, like this. especially the big significant increase is observed in the abdominal area. And also, single dose of flavonoid alleviated feeling of coldness significantly in the whole body by the evaluation of VAS, visual analog scale. So whole body, they felt warm, like that. And next, we made another hypothesis that if flavonoids stimulate lipolysis, so respiration content RQ is decreased during aerobic exercise. So respiration content RQ is this value is equal to 1 when carbohydrates are respiratory substrate in aerobic respiration. And when substrate is fat, the RQ value is about 0.7. So when fat is burned in exercise, RQ value become lower. So we have, this study is open label crossover study, so 10 young women and single oral ingestion of flavonoid. And this is the breast test, like this. So they meta exercise and breast test. So study 2 is a similar study. So this is blind double-blind study, and subjected 10 young women, and repeated ingestion of 300 milligram flavonoid. So this is exercise is treadmill. So RQ was measured. So this is the result of study 1. So RQ in aerobic exercise was decreased by taking flavonoid, which indicates flavonoid can enhance lipolysis during exercise. This is the study 2. So 300 milligram flavonoid repeat ingestion. This almost same result. So flavonoid enhance lipolysis during exercise. So conclusion. So under the condition of the coldness, low test, single dose of flavonoid suppress lowering temperature of body surface area of trunk, such as stomach, or accelerate the rise of temperature. In breast test, during exercise, single dose of flavonoids, 600 milligram as well as 300 milligram of flavonoid decreased respiration RQ value. So the result indicated single dose of 300 milligram of flavonoid enhanced fat metabolism. So now many flavonoid products in the world. In India, Flabonoid is a flavonoid product. And in Japan, this kind of, in Japan and in the US and Europe, so there are many flavonoid products. Thank you very much.
Any long-term study?
Sorry?
You have shown all the 2-month studies.
Just short term.
These are all 2-month studies.
2 months, yes.
Any long-term perspective of this?
Longest study is 3 months.
Okay. So what do you suggest after that? After that, how long you want to continue this? What is the recommendation of this drug?
How long should flavonoid be continued?
How long?
After 3 months.
After 3 months. So longest study was 3 months. And after 1 month, after 3 months, we looked at another 1 month. Looked at rebounding, but we didn't see any rebounding.
Okay.
So this being a dietary supplement, can it be given for a longer duration? You know, like somebody wants to, from 100 kilo, he wants to come to 60 kilos. So can you give it for a longer duration or only 3 months is the optimal time? Firstly, and secondly, what are the side effects of this drug?
So actually, we didn't see any side effects on the 3 months study.
Actually,
Yes,
it can be given lifelong. You can have it lifelong. There is no
And also, the important thing is, we have done the bioavailability study, and we observed flavonoid doesn't accumulate, stay in the body. So it was safe, but we have to take every day.
But how long one can take it? 1 year, 2 years, 3 years?
So as I show that slide, so 2 months is enough, I think.
So in 2 months, one would lose only 3 or 4 kilos. You know, if the desire is that you want to reduce 10 kilos or more, can you give it for a longer time?
Yeah, you can. Actually, I am having it for last 4 years.
Have you lost anything?
I have lost 16 kilos, but now I am not losing anything. But
So that means it comes to a plateau sometime?
it will plateau, yes. But what happens is that the other parameters of metabolism, metabolic syndrome, like lipid profile is in control, blood sugar level is in control, energy levels are good. Basically, you feel energetic and healthy. If I stop having it, suppose I don't have it for let's say a month or a month and a half, then it again your metabolism starts slowing down. So that it just to stay healthy, I am having it. So maybe people can reach a level where they want to quit having it, but it can be given lifelong. There's no side effects. And
you have been taking right from the beginning.
Yeah, you know.
And you have lost 16 kilos.
Yes.
Did you find any change in your complexion?
you have to tell me.
Yes, because glycolis is known to reduce pregnancy.
Yes.
No, Mr. Jha is, Mr. Sandeep Jha is shining today.
Yes.
We can blame it on flavonoid.
Exactly.
Your complexion is improved.
But my point, I would like to make one point. 300 milligram of flabonoid, or your, what was the name you said? We know it as a flabonoid. We are not using that. Actually, we are using for such a long time. Once a day dose. Once a day dose. Mostly we are using primarily because of the cost factor. And that is perhaps 100 milligrams.
No, it is 300.
Yeah, 100.
Oh, that's one is 300. Oh,
So 100.
it's all right. Then we are using 300 milligrams. And for a long time, I have been using, yes, the objective, subjective observation, subjective finding, that sense of well-being, the sense of feeling light, more energy level and all, these are there. Distinctly, I have been seeing there is a little reduction of the abdominal guard, and in a person, most importantly, feels comfortable. And he likes to take it. If I tell him, look, you stop it now, you have taken it for 6 months, he says, let me continue. I'll say, well, if you can't afford taking it, there is a cost factor for the Indian patients. You carry on, but most of my patients I find after 3 to 4 months, they like to discontinue. Or they don't telling me or without my knowledge, they discontinue with me. In certain situations, BD dose also I have written, and similar changes I have been seeing. It's not that lipolysis we are seeing involving the entire body, but prominently we do see in the visceral fat. That is one point for sure. Every one of us can observe that, provided we are using it. So thank you.
But actually, obesity is also a lot to do with lifestyle. Although it will work on the metabolic parameters, but with respect to weight, maybe the person is not losing weight as such, but he will lose inches. The fat he will lose, body muscle mass increases. There are studies which indicate that the muscle mass of the body increases, and the visceral fat percentage goes down. In fact, now we are conducting a clinical trial, sir, in Rajiv Gandhi Institute of Medical Science in Srikakulam, where we are trying to establish that the impact on all metabolic parameters. So that study results are expected by March.
So it will improve the metabolic syndrome,
Yes.
and naturally it will improve all the related disorders.
All the related disorders. Yes.
See, I being a gynecologist and fertility specialist, I am interested in PCOS specifically. Would it help in those patients?
Sir, because PCOD also, stems from metabolic syndrome.
Yeah.
So theoretically it will help. But we don't have any specific data on that, but because it starts from metabolism,
Yeah.
so if the metabolism is improved, it should help in PCOS.
Any work done on that,
Diabetes.
PCOS and Flabonoid?
No. Do we have a study with respect to polycystic ovarian? No. We don't have a study.
What about diabetes?
On diabetes, yes.
Diabetes you have?
Yes. It reduces, at least in borderline cases, it will definitely bring it in control. They will not need to be on any other medication. That is from our experience. But now we are trying to establish it through a proper clinical double-blind study we are conducting. So we'll establish that fact and we'll definitely come to you with the results.
See, your pamphlet says 1 or 2 capsules per day. How do I decide which one?
I think, sir, you should start with
Body
one.
weight?
No, I think you should start with one. And then when it is hitting a plateau and you want some more results, then you go to 2. That is how I also did. So you actually reach a plateau and then you have another one. So twice a day. You can give up to 3 times also. It's safe up to 900 milligrams. So